We want to head to Los Angeles, where the county health department is holding a press briefing. Los Angeles County is instituting a new coronavirus stay-at-home order as cases in Southern California rise. Let's watch.
This order goes into effect on Monday, November 30th, and will remain in effect for 3 weeks until December 20th. The temporary order aims at reducing the risk of transmission several ways, including promoting individuals to remain in their homes and with their immediate households as much as possible, reducing mingling with others that are not in your household, requiring that everyone wear a face covering whenever they are engaging in activities outside their homes, where they are or can be in contact with others not in their household, and requiring that all such activities that occur outside of someone's home require the wearing of face coverings, and reducing capacity at sites where non-household members may mingle so that we avoid any crowding. Next slide, please. Right now, the most important action we can all take to stop the surge is to remain at home as much as possible. Residents are still permitted to travel to and from essential businesses, work at or provide services to a healthcare operation or an essential business, engage in essential activities, or participate in permitted individual or household indoor and outdoor activities while practicing required distancing, infection control, and masking. All public and private gatherings and events with individuals not from the same household are prohibited, except for faith-based services and protests. With such a high amount of transmission in our community, gathering with individuals outside your household, even outdoors, is just not safe, and it puts everyone at additional risk because of the extended contact you may have with others. Public health is also reducing occupancy at various businesses where everyone is required to wear face coverings and distance. The new maximum occupancy limits are as follows. Essential retail is permitted at 35% maximum occupancy. Non-essential retail, this includes indoor malls, is permitted at 20% maximum occupancy. Personal care services can operate at 20% maximum occupancy. Libraries can operate at 20% maximum occupancy. Fitness centers, which can only operate outdoors, are permitted at 50% of maximum outdoor occupancy. Museums, galleries, zoos, aquariums, botanical gardens, all that also must be operating outdoors, can operate at 50% maximum outdoor occupancy. Mini golf, batting cages, go-kart racing, also outdoors only, can operate 50% maximum occupancy. And again, these are limited to one individual or members of the same household at the same time. The next slide, please. There are also a number of outdoor activities and spaces that remain open for individuals or households, including beaches, trails, and parks, golf courses, tennis courts, pickleball, archery ranges, skate parks, bike parks, community gardens, outdoor pools for individual lap swimming, and drive-in movies, events, or car parades. At all of these activities, people need to either engage in them as an individual or just with members of their own household. The exception is outdoor lap swimming, which again, individuals can engage in. It's one person per lap. At drive-in movies, events, or car parades, please note that it is one household and only one household that can be in every car. Schools and day camps remain open, but they may need to close for 2 weeks if they have an outbreak of 3 or more cases over a 14-day period. Playgrounds, with the exception of playgrounds at childcare facilities or at schools, will need to close along with card rooms. Restaurants, bars, breweries, and wineries remain closed for in-person dining and drinking, as there is a high risk of transmission of COVID-19 when people are eating, drinking, and talking together without a face covering. And this is what happens when people are dining on site at restaurants. They are permitted to remain open for pickup, delivery, and takeout, and breweries and wineries can remain open for pickup, delivery, and takeout, as well as for retail sales at 20% occupancy. You can remove the slides. Public health will continue conducting inspections and will inform businesses that are not in compliance about their obligation to adhere to the new safety requirements or face actions. I do ask that all businesses do their part to closely follow the requirements. It has never been more important to do so than now. But no amount of inspections or fines will replace individual compliance. People staying home, not gathering, wearing a face covering properly, and distancing. I understand everyone's frustration. We're headed into the holiday season, and more than anything, we're all longing to spend time with our friends and family. If we really care about each other, and we care about those essential workers taking risks every day to make sure we have food, water, healthcare, and needed services, we need to not gather with anyone not in our immediate household, at least for the immediate future. Even if you're not feeling sick, the simple act of gathering with people outside your household puts everyone at risk. We know that as many as half of the people who are infected with COVID-19 have few or no symptoms, and the daily numbers show us that there are many people currently infected across the county. It doesn't matter if you're indoors or outdoors, we should all avoid being around people not from our household for an extended period of time. And we should operate as if everyone we are around is positive for the virus and can affect others. To residents, we ask you again, please stay home as much as possible. Only go out if it's absolutely necessary, and always wear a face covering over your nose and your mouth and keep your distance. It's very important, and we ask again, please do not gather with people outside your household. We're really trying to ensure that for the next 3 weeks, we do everything we can to get the surge to decrease. Work from home if you can, and if you can't, make sure that at your workplace, all the worker protections are being adhered to. To the businesses, I do understand the difficult situation that many of you are in, and I ask you to please continue to follow all public health safety measures. If you have questions, please do not hesitate to reach out to us at our Environmental Health Division, 888-700-9995, Monday through Friday from 8 a.m. to 5 p.m. We can still turn this around, but it will take significant collective action. The science is clear, from national experts like Dr. Fauci to local physicians like Dr. Moran, an emergency room doctor at UCLA. The message is the same. Activities where you can't wear a face covering and distance from those not in your household are very risky and should be avoided. Yesterday, Dr. Fauci advised all Americans to do their very best to steer clear of bars, restaurants, public transportation, and air travel. This is hard to hear, but it's not complicated. We need to always wear face coverings, not be in crowds, and stay home as much as possible until we can reduce the number of people capable of spreading the virus. We have done this successfully before, and we can do it again. Dead people don't get a second chance. Thank you, and I'll take the first question.
Thank you. And if you want to be put into the queue to ask a question, please click on the hand icon, which is in the participant panel. And for our first question, we'll go to the line of Steve Gregory with KFI News.
Barbara, good afternoon.
Steve.
A couple questions. Have you received any calls thus far in the last 72 hours of any outdoor parties, gatherings, illegal gatherings of any kind? Also, do you have the final authority when it comes to a health order? There's been some confusion as to actually who has the final say and the final word. 2 board members earlier this week obviously voted to sort of repeal the ban on the outdoor dining. Are you worried that it's kind of fracturing the board a bit? And do they have the final say in health orders, or do you have the final say in health orders? And it segues me into my question about lawsuits. Are you worried about lawsuits that are being filed to overturn these bans, specifically the California Restaurant Association? And finally, do you support media as being first responders when it comes to the vaccine? There's been an effort underway, and I just wanted to see what your views on that are.
Oh, thanks so much, Steve. Let me try to get to all of those. I don't really have the list of sort of responses that we might have made over the last 3 days through our environmental health inspectors around parties. Usually what our team does is if we're notified ahead of time that there's going to be a party, we send people out and try to work with the homeowner or the party planner to make sure they understand it's not a permitted activity. And when we need to, we can issue a citation. Other times law enforcement gets called, as you're well aware, when the parties are loud and creating a public nuisance, as well as violating the health officer order. But I don't have good information about parties. I know that on Monday we'll present the results from the last week of compliance checks, and we are working hard to make sure that retailers, in particular those that are essential businesses, understand about creating as much safety as possible and adhering to all of our directives, because we know this is a heightened shopping season. So we want to really work hard that both workers and customers at these sites are protected as much as possible. I do hear you about the lawsuits. I want to thank County Council who, here for us, really take seriously their obligation to look through the lawsuits that are coming our way and may be filed against us, and to recommend additional actions. And I think, we try very hard to make sure that we're using, again, the best information we have with a new virus to make decisions that can be, in fact, supported as absolutely essential for the public's health. But we do recognize both individuals and businesses have the right to challenge that and do so in court. We do ask those businesses that while they're challenging those regulations or safety measures, to please adhere to them until the courts make a decision. In terms of, sort of the authority, a local health officer, and that's Dr. Davis, and many of you are familiar with Dr. Davis, does in fact issue health officer orders with his or her, their authority by law. Here in the county, we've worked really hard to build consensus with the Board of Supervisors and, in fact, to move forward in a way that's united. We think that really helps everybody who lives here and works here. But there are times, as we've witnessed recently, when, in fact, there may not be consensus, in which case we, as a local health department, will continue to advise the board on what is the direction that we recommend and why. And then, as you've seen, at the time where there is a split board, we have moved forward again in consultation with the board to try to put forth the very appropriate steps for the county. This is one of those situations where the more we can all work together, the better we all are. I think it's hard enough on everybody, businesses and individuals, to follow the complexity of the set of rules. We have the state, we have the federal government, we have counties, and we have a new virus, which means that things change. And at this point, we have a surge, the worst surge we've ever seen. So we try as much as possible to build.
You've been watching the Los Angeles Department of Health hold a press briefing updating its response to the coronavirus. We're going to take a quick break. We'll have more news next here on CBSN. CBS News, always on.